We travel across Pakistan, Philippines, and Bangladesh to investigate the social and economic implications of COVID-19 across developing countries.
Kuha namin na lang ng paraan na magkaroon ng mga isolation areas.
Napakahirap. Ayoko nang Ilan din natin kung pwedeng makauwi na ako.
As migrant workers lose jobs, fragile economies are crumbling.
Tuloy-tuloy pa rin operation ng mga crew sa loob ng cruise ship. Mag-decide sila na i-stop na yung siguro nung wala na yung passenger mismo doon.
Leaving a trail of unemployment and desperation.
টুটুল ভুঁইয়া ওবায়দুল্লাহ টুটুল ভুঁইয়া গতকাল তার স্ত্রীকে নৃশংসভাবে কুপিয়ে হত্যা করে।
Lockdowns are exposing existing cracks in developing economies.
अब इसका हल क्या है कि हम अल्लाह की तरफ रुजू करने वाले बन जाएं, मसाजिद को आबाद करने वाले बन जाएं। ये छोटा सा मास्क हमें कुछ नहीं बचा सकता अगर अल्लाह ताला का अमर न हो।
We embed with frontline heroes.
ये हम जब भी लेने जाते हैं पेशेंट को तो हमें कभी भी डर नहीं लगता.
As they battle for survival with innovation and technology.
Probably largest stoppage of education services anywhere in the world.
March 2020, Islamabad, Pakistan. Prime Minister Imran Khan announces a nationwide lockdown as the COVID-19 virus spreads across the country. Fumigation drives are conducted in neighborhoods. Train carriages grounded as part of travel bans are repurposed as hospital wards. Drive-through testing areas are established by the government. The army is called in to maintain social order. But pressure from clerics forces the government to reopen mosques. Despite instructions to observe social distancing during prayers, the implementation is weak. Islamabad's Red Mosque openly flouts the order.
ये कोरोना से ये हाथ धोना तुम्हें नहीं बचाएगा.
They conduct routine Friday prayers with no social distancing measures in place.
मदारिस को बंद किया जा रहा है और मसाजिद को बंद किया जा रहा है. यहाँ तक कि हरमैन शरीफैन को भी बंद कर दिया गया है. अब इस मसले का हल पूछा जा रहा है कि इसका हल क्या है, लेकिन अफसोस और दुख से कहना पड़ता है इसका हल अमेरिका और बरतानिया और चाइना से पूछा जा रहा है. इसका हल कुरान और सुन्नत से नहीं पूछा जा रहा.
The Red Mosque is led by hardline cleric Maulana Aziz, notorious for waging an armed rebellion against the Pakistani army in 2007.
तो हमारा मौक़िफ़ ये है, सन 2007 से पहले से चल रहा है कि कुरान और सुन्नत को नाफिज करना चाहिए. लेकिन चूंकि हुकूमत ये समझती है कि ये आप कुरान और सुन्नत को नाफिज करके हमारे जो कवानीन हैं उनके जो हुकूमत जो इस वक्त चल रही है या हमारा आइन और निज़ाम और कानून है उसकी खिलाफ वर्जी कर रहे हैं. आप रिट ऑफ द गवर्नमेंट को चैलेंज कर रहे हैं. तो हमारा मौक़िफ़ ये, आप तो अल्लाह की जो रिट है उसको चैलेंज कर रहे हैं. ज़मीन तो अल्लाह ताला की है, हुक्म अल्लाह का चलना चाहिए, उसको आप चैलेंज कर रहे हैं.
मौलाना साहब, अगर हम मास्क पहन के मुंह पे मास्क पहन के नमाज अदा कर लें बाजमात तो वो ठीक रहेगा, वो थोड़ी एहतियात हो जाएगी उससे.
नहीं, हम कोई मास्क पहन के आता है हम उस पर इश्काल नहीं करते, लेकिन अपना अपना मौका होता है. मैं तो अभी जुम्मों के बाद नमाज का हम पहनते हैं, अल्लाह पर भरोसा करते हैं, मुआनका भी करते हैं, मुसाफा भी करते हैं, लेकिन अगर कोई पहनता है तो हम उसको रोकते हैं. अब इसका हल क्या है कि हम अल्लाह की तरफ रुजू करने वाले बन जाएं, मसाजिद को आबाद करने वाले बन जाएं और मदारिस को आबाद करने वाले बन जाएं, अल्लाह ताला की फरमाबरदारी करने वाले बन जाएं. न ये कि मसाजिद बंद कर दी जाएं, हरमैन को बंद कर दिए जाएं. ये छोटा सा मास्क हमें कुछ नहीं बचा सकता अगर अल्लाह ताला का अमर न हो.
Such violations, along with the general lack of awareness in the country, has helped spread the virus in Pakistan. By 19th May, more than 43,000 are infected and 1,000 deaths recorded, forcing the Pakistan Islamic Medical Association doctors to hold an emergency press conference.
तो बहसे के मजमूई जो क्रिटिकल सिचुएशन है या जिसे आप गंभीर सूरत हाल कह सकते हैं, लेकिन बुनियादी बात यह है कि हम सब मुसलमान और ये जो रमजान का महीना है, हमें इस मौके पे इस चीज को एहसास करना चाहिए और मारूदी हक़ाइक़ को देखना चाहिए कि मुसलमान के लिए अल्लाह ताला ने पूरी जमीन को मस्जिद करार दिया है. उसके लिए कोई मखसूस जगह नहीं है.
The surge in cases have put pressure on Dr. Maz Aslam. He's an ENT specialist stationed at the Corona ward at Benazir Bhutto Hospital in the city of Rawalpindi.
So currently, the rate of infection in the doctors in Pakistan is extremely high. Pakistan is no exception, and because of being a developing country, the shortage over here is even more severe as compared to the rest of the world. आहिस्ता आहिस्ता कोरोना पूरे में फैलता जा रहा है, तो पूरे हॉस्पिटल को कोरोना में इस्टेब्लिश किया जा रहा है इस वक्त. और इस वक्त भी तमाम पेशेंट्स कोरोना वाले ही हैं यहाँ पर. और साथ बुखार भी है, इसमें बुखार नहीं है. और ये जो सा है आपको, मतलब अभी इनके जो टेस्ट हैं आपके, वो तो हो गया ना अल्हम्दुलिल्लाह. ठीक है, बहुत शुक्रिया भाई.
4 months since the outbreak began, more than 3,600 doctors, nurses, and medical staff have tested positive for the virus nationwide. Unofficial counts attest that more than 70 doctors have died. On condition of anonymity, one doctor shared her experience with us via email. Proper PPE is not being provided in the main ER. No doctor touches this patient. The patient eventually dies without adequate medical attention. Doctors go on a hunger strike in the city of Quetta, demanding the government provide 30,000 PPEs per day to medical professionals across Pakistan. After a brief skirmish, the doctors are arrested. In Rawalpindi, Dr. Maz takes matters into his own hands. He manufactures 750 reusable PPE kits per day. He employs 60 tailors at a time when the economy is on lockdown. In total, these doctors have distributed 6,500 kits for free, helping low-wage frontline staff like Faisal Obaid. He's an ambulance driver at the ED Foundation, the biggest charity-run ambulance service in the world.
जो कोरोना की डेड बॉडी लेके आए ED फाउंडेशन एम्बुलेंस पे आरजे अच्छे कल्याण शरीफ दफनाने के लिए.
He's helped transport patients and COVID-19 fatalities for burial across Rawalpindi.
हमें ED फाउंडेशन ने प्रोटेक्शन के लिए ये किट दी होती है जो मैंने पहनी हुई है. इसके अलावा मास्क और गॉगल्स भी लगाए होते हैं हमने जब हम पेशेंट को लेके जाते हैं. अगर खुदा ना खास्ता हमें कोरोना हो जाए, इसका डर तो रहता है, लेकिन हम इंसानियत की खिदमत के लिए ये काम करते रहते हैं और हमारे दिल में कोई डर नहीं आता.
Because of limited resources in this vast country of 212 million, Prime Minister Imran Khan introduced the idea of smart lockdowns to isolate and close only those areas that have confirmed COVID-19 cases. In the neighboring city of Islamabad, This is the nerve center of COVID-19 operations. Officials are focusing on rural areas where awareness about the virus is low. In the city of 2.3 million people, these doctors are ensuring that the lockdown yields positive results. The unit operates 24/7 and is manned by 20 surveillance teams. They are led by District Health Officer Dr. Zaim Zia.
Surveillance is the key. आप लोग फील्ड के ऊपर हम आप लोगों को इंडिपेंडेंट इसलिए रखते हैं कि इट्स योर जॉब कि आप डिसाइड करें कि किसको टेस्ट करना है और किसको नहीं टेस्ट करना, किसके साथ फर्दर इन्वेस्टिगेशन करानी, किसके साथ नहीं करानी, कि उन्होंने डिफरेंट मॉडल्स फॉलो किए। अभी यहाँ पे जो ट्रैक टेस्ट एंड क्वारंटीन है, दिस इज एग्जैक्टली व्हाट हम यहाँ पे कर रहे हैं। जितने भी यहाँ पे सस्पेक्ट्स हैं, जितने भी मतलब एरियाज हैं, वहाँ से कंटिन्यूअसली जाके लोगों को सर्च करना और उनको उनकी सस्पिशन की बुनियाद पे, कॉन्टैक्ट की बुनियाद पे वहाँ से उसको लेके आना, उनको टेस्ट करना और उनको फर्दर इन्वेस्टिगेट करना। ताकि कि किसी का सिफारिशी टेस्ट नहीं लेना, किसी का नंबर बराबर करने के लिए टेस्ट नहीं लेना। आप लोगों के पास जो चीज़ें हैं वो बहुत एक्सपेंसिव चीज़ें हैं। एक्सपेंसिव इसलिए नहीं कि उसकी कीमत ज़्यादा है, वो एक्सपेंसिव इसलिए है कि वो हमारे पास अवेलेबिलिटी उनका बहुत बड़ा इशू है। तो एक दो माजी में मेरे ख्याल में बाज़ लोगों ने ना अपने टेस्ट पूरे करने के लिए किसी को साथ में बुला के इधर आया तो तुम्हारा टेस्ट लेता हूँ।
Today he's been informed of an outbreak in Shah Allah-Ditta, a rural suburb of Islamabad. 70% of Pakistan's population live in rural areas. Many believe the virus is a hoax, so the medical response has to be quick.
रैपिड रिस्पांस टीम्स और सर्वेलेंस टीम्स बोथ जो है इनको रिस्पॉन्ड कर रही होती हैं इमरजेंसीज़ को। और जैसे कोई पेशेंट होता है, उसको कोई एक्यूट प्रॉब्लम हो, रात को, दिन को, किसी भी टाइम, तो उस टाइम ये जो है रैपिड रिस्पांस टीम्स को पिक करती हैं और उनको ड्रॉप करती हैं। अदरवाइज सर्वेलेंस जो टीम्स है वो कॉन्टैक्ट ट्रेसिंग करते हैं। कोई पॉजिटिव आता है तो उसके जो फर्दर कॉन्टैक्ट्स हैं उनको।
On arrival, his team tread carefully.
कबल इसके कि ये ज़्यादा फैले, हम इसको पूरे एरिया को कॉर्डन ऑफ करा दिए ताकि हम इन्हें कॉर्डन ऑफ कराने के बाद मूवमेंट रिस्ट्रिक्ट करने के बाद हम सारे सैंपल्स लें और इंश्योर करें कि जो जितने घर हैं वो क्लियर हैं। और 14 दिन तक हम इसको बंद रखेंगे, उसके बाद हम रिकमेंडेशन देंगे अगर डिजीज़ कंट्रोल हो तो। जितने भी और भी इसके रिलेटेड लिंक्स हैं उनको भी देख लीजिए, क्योंकि दिस कुड बी अ ह्यूज एपिसेंटर कि यहाँ से अगर चीज़ निकल के बाहर जाती है, और ये बहुत सारा एरिया है, यहाँ से अगर दूध अगर कहीं बाहर जा रहा है।
More than 100 tests are run by Zaim's rapid response and surveillance teams in this area today. They record personal information and travel histories for everyone in this suburb.
अच्छा, आपकी थोड़ी इन्फॉर्मेशन हमने इसमें एंटर करनी है, तो कुछ सवाल पूछूंगा, आप उसके जवाब दे दें। उस मीटिंग में हामिद शाह साहब।
A week later, 8 people have tested positive for the virus. World Bank data estimates Pakistan has 0.5 hospital beds per 10,000 people. Due to such limited healthcare facilities, infected Pakistanis will be quarantined in their own homes. It's the best option available, given the scant resources. Staff disinfect the neighborhood with chlorinated water. This is a routine affair for Dr. Zaim and his team. But while the system seems to work, the stigma surrounding COVID-19 has been difficult to shake off.
Major concerns that I have at this point is a lot of people stigmatize the patients with the COVID. It's a pandemic and anybody can get the disease from anybody. At this point, I think we have to be kind and empathetic towards the patients who are suffering from this disease, rather stigmatizing them in the society.
By mid-July, Pakistan chalks up over 250,000 COVID-19 cases. But the country isn't giving up. Next, we look at how Pakistan's IT sector is transforming the face of education. COVID-19 pandemic has created a global crisis, resulting in a critical economic and social emergency. It's caused the closure of schools, affecting up to 1 billion children and youth, the biggest disruption to schooling worldwide since World War II. In Pakistan, 50 million children have had their education abruptly halted by COVID-19. In the province of Punjab alone, nearly 50,000 public schools are closed, affecting some 10 million students. This is when the technology arm of the government of Punjab intervened.
Digital technologies can play a tremendous role in pretty much every walk of life, and education is no exception. This was a big challenge for us. We don't know how long this COVID-19 thing is going to last, so we need to figure out a way to ensure that this continuity of education is sort of maintained. So I think this whole idea of Talim Ghar, it really came from trying to use digital mediums and digital channels to sort of continue with the education for the students.
अस्सलाम वालेकुम बच्चों, आज हम क्लास 4 की साइंस के चैप्टर नंबर 1 अपनी पहचान अंडरस्टैंडिंग आवरसेल्व्स के बारे में पढ़ते हैं.
Within a month, efforts by a committed team led to the invention of Talim Ghar, an application that literally means home education.
Hi, it's Manu here, and today we are going to dissect a frog virtually by the help of a simulation.
Mahnoor works as a program officer at the Punjab IT board.
काम है ऑलरेडी जो हम बना रहे हैं एनिमेशंस और ये जो लेक्चर्स प्रिपेयर कर रहे हैं ये हम इसी तरह कंटिन्यू रखेंगे. दूसरा हम मार्केटिंग पे तवज्जो देंगे और इसकी मार्केटिंग को ज़्यादा बेहतर करेंगे ताकि लोगों में ज़्यादा अवेयरनेस क्रिएट हो और ज़्यादा से ज़्यादा लोगों को इससे फायदा हो.
Her team of animators huddled and coded a prototype within 4 weeks. The team aims to provide home-based schooling to children from grade 1 to 8.
This app has been downloaded more than 500,000 times. You can tell us more about how you came up with the design, the color combinations, and the characters for the Talim Ghar app.
We introduced our main 8 characters, 8 teachers, and those teachers were actually named after very famous scientists and famous personalities like Einstein, Newton, Arfa Karim, Madame Curie. So those teachers actually helped us building a whole video lecture where we incorporated simulations, games, quizzes, and it was a complete package for the students to distance learning solution at their homes. Through technology, we were able to provide students with a very, a very quick and easy way to learn from their homes without without going outside or exposing themselves to corona or something.
क्या आप बता सकते हैं कि इस सवाल का जवाब?
Now, the third.
With mobile penetration increasing, Pakistan aims to address a much larger problem. It has the second highest number of out-of-school children in the world due to a lack of school infrastructure and teachers. That's an estimated 22 million children aged between 5 and 16 out of school across Pakistan.
All right, this was supposed to be a COVID response, but there's a byproduct to it, which is that the number of children, so in Punjab, 5 million children estimated are out of school. You're also reaching out to them, the children who were never able to come to school. So that is a very significant positive impact. So because of that, we're actually strategizing now to sustain it for next at least 1 or 2 years and then go beyond that as well.
In addition, more than 850 local cable operators will carry the lectures on free-to-air television, reaching 90% of Punjab's population. Talim Ghar has helped Saeed and Zara, who are now teaching their 6-year-old son at home.
बच्चों का आपको पता ही है कि ज़्यादा से ज़्यादा आजकल बच्चे जो है मोबाइल में ज़्यादा घुसे रहते हैं या मोबाइल ज़्यादा देखते हैं, पोएम्स वगैरह और ये वो. तो मेरे ख्याल से ये जो ऐप है इससे इनको ज़्यादा हेल्प मिल रही है क्योंकि बच्चों का फेवरेट तो आजकल यही सोशल मीडिया टाइप चीज़ें और ये सब पोएम्स वगैरह सब राइम्स वगैरह ऑलरेडी सोशल मीडिया पे मौजूद हैं. तो बच्चों का रिस्पांस तो बहुत अच्छा रहा है क्योंकि वो ऑलरेडी इसमें है.
Despite the rising number of COVID-19 cases, Pakistan is slowly opening the economy to address the rising unemployment in the country.
It's not just Pakistan. I would imagine the same in India, in the subcontinent, in African countries. You know, if it spreads, we will all have problems.
Another developing economy that's been reeling from the disruptions of COVID-19 is Bangladesh. Unofficially, the country's total number of infections has crossed 750,000. And these numbers are rising. The biggest impact of Bangladesh's lockdown fell on the garments and textile sector, resulting in millions of daily wage earners losing their jobs. Workers in Dhaka demanding unpaid wages clashed with police. The textile industry alone employed 4.1 million workers before the pandemic. 65% were women like Rubina Akhtar. She worked as a seamstress at a local garment factory.
তারপরে হঠাৎ করে আমরা শুনি যে ফেব্রিক উঠাইয়া নিয়ে যাইতাছে প্লাস মেশিন উঠাইয়া নিয়ে যাইতাছে ফ্যাক্টরি আর চালাবে না ওনার এটা ভাড়া বিল্ডিং ছিল ওনার স্থায়ী জায়গায় চলে যাবে নিজের বিল্ডিং
Due to the drop in demand, many foreign buyers cancelled orders. Most Western high street retailers selling Bangladeshi-made apparel deferred payments for up to 6 months, leaving factories in Dhaka with liabilities of $3 billion.
উনিও বাধ্যতামূলক উনির কোনো দোষ ছিল না উনির শিপমেন্ট ছিল সামনে বিমান চলে না কাজ আদান প্রদান হয় না উনি কাজ না নিলে আমরা বসে কই থেকে বেতন দেব ওই জন্য উনি এই পদক্ষেপটা নিচ্ছে আমার শুধু একটাই আমার একটা যেই কোনো নিম্ন স্তরের হোক সঠিক পথে হালাল পথে খারাপ ছাড়া সঠিক পথের একটা যেই কোনো সাধারণত অল্প বেতন হলো আমার একটা চাকরির দরকার আমি চাকরিটা পাইলে আমি খুশি এবং আমি এনাম আমার বাচ্চাকেও আমি পরিচালনা করতে পারবো আমার বাচ্চারা লেখাপড়া করে আমার একটা বাচ্চা মেয়ে বাচ্চা আমার স্বামীর কামাই কম আমি বস্তিতে থাকি
Work for these women can only be done in factories. Now confined at home and facing increasing financial distress, many have become victims of another shadow pandemic, domestic violence. On April 15th, Ubaidul Haq Tutul, a resident of Dhaka, live-streamed the murder of his wife on Facebook. This murder, reportedly over a financial dispute, shocked the rest of the country.
টুটুল ভুঁইয়া ওবায়দুল হক টুটুল ভুঁইয়া গতকাল তার স্ত্রীকে নৃশংসভাবে কুপিয়ে হত্যা করে এবং সে হত্যা করে ক্ষান্ত হয়নি সে তার ফেসবুক আইডি টুটুল ভুঁইয়া থেকে সে হত্যাকাণ্ডের লাইভ পোস্ট দিয়েছে
58% of women in Bangladesh face domestic violence. According to UN Women, this figure has drastically increased due to COVID-19.
About 4,000 women said that they are facing some sort of violence. The other figure that we have is the decrease of women being able to report violence. International Rescue Committee had said in Bangladesh the access to their support services have decreased by 50%. And this is natural because women are not able to go outside of homes. But this decrease of the access to services, we shouldn't take as a decrease in the incidence of violence themselves. The incidents are rising.
The rise in violence against women due to COVID-19 lockdowns is a global phenomenon, affecting developed countries as well. In Australia, a Women's Safety New South Wales survey reveals that 40% of frontline workers have reported increased requests for help by survivors. But in Bangladesh, the violence stems from a myriad of underlying issues.
These are often related to social taboos, our cultural issues, religious issues,
and financial economical issues. And overall, every country has a different, set up of people. The police alone cannot actually eradicate or stop women and child repression.
The Ministry of Women and Children Affairs is fighting back with a helpline and shelter service.
হ্যালো, আসসালামু আলাইকুম। জি, নারী ও শিশু নির্যাতন প্রতিরোধে ন্যাশনাল হেল্পলাইন সেন্টার থেকে বলছি। জি বলুন, কি হয়েছে? আপনি প্যানিক হবেন না, আপনি নর্মালি আমার সাথে কথাগুলো শেয়ার করেন, কান্না বন্ধ করেন, আগে রিল্যাক্স হন। জি।
Mehdi Sultana is a helpline officer who counsels and organizes shelters for women in distress.
যতদিন থেকে শুরু হয়েছে তখন এটা আরো বেশি বেড়ে গিয়েছে, কারণ আগে একটা জিনিস হতো যে মারধর করছে, উনি বের হয়ে চলে যাচ্ছে, কোথাও একটা চলে যেতে পারছে, বাট এখন বিষয়টা এরকম হয়েছে যে কোথাও যেতেও পারছে না, এবং ওইটা চিন্তা করেই ওই লোক ওনাকে টর্চার করছে বা ওইভাবে মানসিক প্রেশার দিচ্ছে, মারধর করছে, যে এখন কিছু হলেও উনি কিছু করতে পারবে না, সেই চিন্তা করে আরো দিন দিন বেশি বেড়ে যাচ্ছে। আর যেহেতু পুরুষরা এখন বেশিরভাগই ঘরমুখী, সারাদিন ঘরে থাকছে, তো সেই ক্ষেত্রে একটু ঝগড়াঝাটি টুকিটাকি কিছু হলে গায়ে হাত তুলছে, যে এখন পুলিশের কাছেও যেতে পারবে না, আইনি কোনো ব্যবস্থা নিতে পারবে না, সেই চিন্তা থেকে হয়তোবা এটা আরো বেড়ে যাচ্ছে।
Despite government measures, the economic meltdown continues to have serious repercussions on developing economies. After the break, we travel to the Philippines to understand the plight of thousands of economic migrants. The UN estimates nearly $1 trillion in economic losses worldwide due to COVID-19. The ensuing lockdowns and disruptions have cost the jobs of 163 million migrant workers globally. Within India alone, 400,000 domestic migrant workers are unemployed after Prime Minister Modi announced one of the world's biggest lockdowns. Meanwhile, in the Philippines, 2.3 million overseas Filipino workers brace for job cuts. They include the country's large ranks of maritime workers. Close to 700,000 Filipinos depend on work on board ships sailing the world. More than 24,000 have been repatriated, having served quarantine orders. Many are still making their way home.
There are 24 cruise ships docked right now at Manila Anchorage, and they are there to disembark the Filipino crew that they have, and they're just waiting for the result of the swab test that we conducted together with the Bureau of Quarantine. We're just continuing our what we're doing right now. There are a lot of Filipinos coming over all over the world, and we're preparing for that. And we're expecting around 40 to 50,000 more Filipinos to arrive here in Manila.
Transmissions of the virus from returning seafarers account for the spike in COVID-19 cases in the country. President Duterte imposed a strict lockdown with shoot-to-kill orders for violators. By July 2020, the Philippines' case tally climbs to 50,000 infected. The lockdown has claimed the livelihoods of millions of Filipinos at home.
Well, we expect the lockdown directly to have affected at least 19 million jobs in the Philippines. We're not sure if how much of those are actually lost permanently, but definitely there are at least job losses or income losses. I think the problem is that right now the Philippines is facing its worst mass unemployment in its history.
Pastry chef Aline Dyer is happy to have made it home. A few months ago, she was stuck on board the Diamond Princess cruise liner. She was barred from returning home due to travel restrictions imposed by most countries. Aline helped raise her 2 children in Manila on a salary of $1,200.
Nasa 560 yung mga seafarer crew members sa loob ng Diamond Princess. Pero all in all is 1,100 sa buong mundo. Eh syempre ako, magiyak-ngiyak na rin ako, no? Parang nag-worry na rin ako kasi marami na rin bawat araw times 1, times 2, times 3 hanggang dumarami na. Ang bilis talaga dumami ng mga corona. Ang pagkakaalam ko, pero ito tentative lang, hindi ako sure. Pero nasa 50 yata ang nag-positive na mga Pilipino. At saka, yun ang naiwan dun sa Yokohama, Japan. Yung mga negative naman, yun, pinauwi kami at inano kami sa Kapas Tarlac, Pampanga. Dinala kami dun. Doon kami quinarantin.
Seafarers like Arlene Dyer are the lucky ones who've been able to return home. But thousands of migrant workers are still stuck in cruise ships across the globe, being forced to continue their jobs despite catching COVID-19.
At habang sila ay naka-stranded, binabiolate ng kumpanya yung protocol ng WHO, no? Na-quarantine. Kasi ang naka-quarantine lang sa loob ng mga cabin, sa loob ng mga kwarto, ay yung mga passengers. Yung mga crew, kasama na yung mga Pilipino, pinagtatrabaho pa rin. So wala silang social distancing, pinagtatrabaho at tuloy-tuloy pa rin ginagawa. Na-expose sila sa mga passengers, na-expose din sila sa isa't isa.
In Manila, lawyers working at Migrante, an NGO set up for migrant workers, are struggling to get seafarers back to the Philippines, a task made more urgent after reports of suicides on board vessels.
They promised a one-time financial assistance of $200 or 10,000 pesos to each OFW who have lost their jobs or who are under no work, no pay policy. However, based on the reports from our government, only 20,000 or so OFWs have received this financial assistance out of the targeted 135,000 who are supposed to receive. So we are talking about thousands of our migrant workers stranded overseas and also who have been repatriated back with no livelihood, no income. They are severely experiencing starvation, lack of resources. So the migrant workers are in need of basic food and shelter that they cannot afford to do so.
Seafarers who've managed to return are not doing well financially. Gregorio Ridwal worked on a ship in South Korea for $400 a month. The pandemic left him grounded and out of a job. He's back in his hometown of Agu.
Tapos nung ilang araw po kami doon sa barko, bali 8 araw, tapos pinauwi na po kami dahil sa COVID nga po. Nung nakarating na po kami sa sa Pilipinas, sabi ng doktor doon sa airport kung yung pwedeng umuwi na kaya marami daw tao sa OWA, kaya umuwi na po kami, sir.
Renovations on his house are long overdue. They're funded by savings from a 17-year career on fishing vessels, plying faraway waters.
Ito po yung pagka-OFW ko na bahay, sir, pinapagawa ko. Matagal, sir, bago hindi pa natapos hanggang ngayon. Doon nga po sa sir, sa Russia kami mahirap pong trabaho doon. Nag-ano po kami ng isda. Nagkakamada ng isda, naglalagay sa freezer. Mahirap po ang trabaho namin, tapos konti lang yung sahod po namin, sir.
Since COVID-19, overseas Filipino workers like Gregorio have few career options. 2020 will be the first time this century that the number of Filipinos living under the poverty line will rise. The Philippines expects to have 1 million more people living under the poverty line, while estimates say Nigeria and India may add 8 and 10 million more to their respective poverty rolls in 2020. By the end of the year, roughly 265 million people could be on the brink of starvation globally. In a worst-case scenario, 300,000 people could die every day if conditions don't improve economically. In the Philippines, some communities are taking urgent steps to prevent an impending food crisis. Ferdinand Leo in Lipa, Batangas, converts the Divino Amor Church into a market every Wednesday to help poor farmers.
Matan natin nandito yung mga sayote, cauliflower, baggy beans, carrots, repolyo, kamatis. Itong mga paninda nila dito, every week ay nagbababa sila dito ng mga gulay upang kanilang ipaninda. At ang iba rin dito, ilang porsyento ng mga tindang ito ay binabahagi nila para sa mga nangangailangan din nating mahihirap. Naging katawag na sila sa ADAPA family. So ang ating binibigay hindi lang bigas, kasama yung sariwang gulay mula sa ating mga kapatid na taga-Cordillera.
Once the food is ready, members of this church scout for areas where aid is needed, sending reports to the church for action. They also serve hot meals to frontliners working in hospitals and clinics around the city. Even as the Philippines continues its protracted battle against COVID-19, new flashpoints are emerging. We get rare access inside a Filipino jail to examine the spread of this virus among the incarcerated.
Napakahirap. Ayoko nang mag-ano.
As world economies slowly open up, the Philippines plans to extend its lockdown beyond the initial 9 weeks in some areas, stretching one of the world's strictest community quarantines to contain COVID-19 outbreaks. Overcrowded cities like Manila face a massive challenge to maintain social distancing. But the going gets even tougher when the virus outbreak reaches cramped prisons. The Philippines has one of the highest jail occupancies in the world. That's heightened fears that prisons will emerge as the epicenter of the virus in the Southeast Asian nation. This is the Correctional Institution for Women in Metro Manila. Heidi Caverte is chief nurse at this women's jail. She's worked here for the last 10 years. She believes the risks of infection run high, even for staff.
Very risky, sir, kasi every time na papasok kami sa loob, although na nasa-swab kami, kahit nagne-negative kami, pero pumapasok pa rin kami sa loob kasi wala naman pong sa kanila, mag-aalaga, titingin sa kanila. Kaya kami na rin pong mga nurses ang nagro-rotation para sa loob. 48, ang ginagawa kasi namin ngayon is, ang dutyhan namin ng mga nurses, dalawang team kami, 48 hours, diretsong duty yun, tapos 2 days off kami. Yun yung so very risky. Pero wala naman kami magawa kasi baka kailangan din ng mga PDL ng pangangalaga at saka attention.
In May, the outbreak spread further. 2 jails in Manila announced a total of 348 infections among more than 8,000 inmates. To understand the severity of the situation, we get rare access to the Correctional Institution for Women's COVID-19 testing area.
Pagkatanggal mo, basang-basa ka talaga sa pawis para ka naligo. Mapipiga mo yung damit mo.
Pinapas ka, di ba?
Ipa natin.
The CNA crew gears up. Personal protection equipment has been issued by the prison.
Ako na po papasok. Ay, ikaw lang po. Jason, pahal niyo, sir.
Gawa namin na lang ng paraan na magkaroon ng mga isolation areas. Papasok!
Ito na po sila.
Sir, hanggang dyan na po.
Nurse Bianca Ramos is in charge of isolated inmates suspected of being infected with COVID-19.
Ano po yung first station namin, sir? Tutong chapel area na pansamantalang ginawang lagayan po ng mga positive ng COVID po. Hirap po kasi sobrang sikip po nila. Mahigit sila sa 3,000 lahat. Mahirap sa social distancing dahil wala silang lugar. Sa 3-meter radius, hindi talaga kakayanin yun. Pero kaya nagagawa namin na lang ng paraan na magkaroon ng mga isolation areas. So, hanggang dyan lang po.
The official capacity of this jail is 1,000 inmates, but today its population has crossed 3,000. The arrival of COVID-19 has made life hell for those locked up inside.
Nailis na po ako. Nalipot na ako. Nahirapan na kami doon eh. Ngayon, hirap na rin po ako. Napakahirap. Ayoko nang napakahirap. Kaya yun ang dinanay ko, pwedeng makauwi na ako. Dahil hindi ko na kaya, parang hindi ko na makakayanan eh.
Sana po si Pangulong Digong tulungan niya po kami para makauwi na po kami. Matagal na po kami nangungulungan eh. Marami naman po nabago na sa amin. Meron naman po kami kasalanan, patawarin na po nila kami para makauwi na po kami.
78 prisoners have already tested positive for COVID-19 here. But there's limited testing, promoting fears that infections could be higher. Fidesz Lim has been campaigning for the release of low-level offenders and political prisoners like her husband.
The death tally right now is the big mystery or big question, because even Human Rights has come out with a report questioning why there is no accurate reporting or even tally by the prison agencies, which are the Bureau of Corrections and the Bureau of Jail Management and Penology. They stopped counting, I think, around the middle of April, when they would report the transfer of prisoners from the Correctional Institute of Women in Mandaluyong.
Her campaigning worked. In May, in a bid to slow COVID-19 infections in its overcrowded jails, more than 10,000 prison inmates were released by the Supreme Court of the Philippines. Elsewhere in the Philippines, there are stories of personal sacrifice and community action. We travel to the province of La Union.
Good morning. Also, welcome. Dito ako natutulog.
To meet Dr. Dave Masias at the Agu Medical Hospital.
Scared? Why scared?
Worried about infecting his family at home, Masias sleeps at the hospital.
Morning, ma'am.
Good morning.
Hello.
Good morning.
Hello. Pang-invite natin.
Good morning.
The lack of isolation units is a key factor driving infection spikes in developing countries like the Philippines.
Nagpakuha ka na lubag? Sige.
Dr. Masias managed to build a makeshift isolation unit within days.
There's no cure for COVID disease, so we focused our efforts in preventing the spread of these infections. we controlled on flow of people going out and going in Agoo, so thus to prevent getting infection from other places and also to prevent the transmission of the virus.
Dr. Messias is working closely with local government officials to maintain the health and safety in the town.
Like I mentioned earlier, we're asking for everyone's cooperation and for their understanding. Naiintindihan natin na mahirap talaga yung situation na ngayon, and we want to help them as much as we can. But in cases na ganito kasi, it's necessary talaga na ma-isolate sila at ma-test na sila before we let them back to their homes and to the community.
Such isolation wards help break clusters, thereby slowing the spread between hospitals as well. The community's fight against the virus is reaping rewards.
Social distancing.
The nearby La Union Medical Center celebrates another discharge today amidst the steady slowdown of admissions.
Good luck. Yung patient po natin ngayon, si Miss Y, will be discharged this morning. Actually, siya na lang po yung natitirang confirmed case namin of COVID. And it's 30 days since he was admitted. Already classified as recovered because he has 2 COVID test swab na negative. So
there's good reason for celebration. It's also the recovered patient's birthday. Although the road to recovery is long and arduous, there is every chance of victory. But the challenges post-COVID-19 for developing countries will be profound. Estimates suggest more than 500 million people will be pushed below the poverty line. Social enterprise, a focus on food security, and the clever use of technology need to be reimagined before our new way of life can emerge.
कित्थों चली ते कित्थे आ गई नी मैनू बात समझ ना आई हस्ती पौंदी पौंदी ने मैं